Yeah, you do your stuff.
It's almost there. Okay, and we are live. Hello, web shadowers. Welcome back. This is our 5th session for fall 2021. We're super excited to have you guys. And today we have the pleasure of hosting Dr. Jeremy Grossman, who will be teaching us about internal medicine and pediatrics. So as always, please remember the Google form will be posted in the chat and in the description of this video when the session is over. So with that being said, if everyone wants to send any questions into the chat, I'll be sending them all through to Dr. Grossman for you. And Dr. Grossman, you can take over whenever you're ready.
All right. Hey everyone, how you doing? Thanks for tuning in. These sessions are always a blast, and when I can't look at you, it's always interesting because I'm just looking at myself, talking to a video of myself. So I guess it's very introspective and spiritual. But I guess I'll be getting your texts and your questions in the chat. So start thinking about what you want to ask me, because this session is about you guys. I mean, I'll give a little intro about myself, and I'll tell you a little bit about what I do. But ultimately, you know, you guys and gals can all go on Google and search stuff, and there's some questions that are just like not there, or maybe questions that you can't really get answered or really trust if the answers are online, like on Reddit or something. So that's what I'm here for. I'm here to tell you the real deal. My name is Jeremy Grossman. I'm a physician out in Long Island right now. I'm a resident. I can explain what that is in just a second. A certain type of physician. I'm originally from California, and I went to school for biology at the University of California, Irvine. Couldn't decide if I wanted to do med school, so I went to psychology, then went back to biology and back and forth. So I decided to just do both. So I ended up getting 2 degrees. I don't recommend that for everyone. I'm just very indecisive. And that's a trend you'll see if you keep listening. So I finished my degrees. I did a little bit of research, never published, but took a year off. And I eventually took my MCATs, and I took it twice to see if I could get a better score. I scored about the same. It was the old version and the new one. So I was the first person, or one of the first set of people to take that new MCAT that you all are taking a few years down the road. So you can thank those quartiles from me and my people. Okay, what's next? I then took that year off, and I also worked, made a little bit of cash, and then I applied for school. So I applied, and I recommend everyone do this. USMD, right? You want to go to Harvard? Fine, apply to Harvard. All your USMD schools. I recommend everyone apply to USDO schools. It's still a doctor degree. You're still a doctor. You're treated and looked at exactly the same. Apply to DO. And I apply to US international schools. So that includes Caribbean medical schools, schools in Israel. There's also some schools in China you can apply to, schools in Europe. I didn't apply to those. I just chose the Caribbean, and I chose Israel because I have a connection to that country. And eventually, when it came time to do the applications, I was doing my applications, and midway, in the middle, it was like second round apps. I wasn't even done submitting them. I got a message back from the school in Israel that said, "Hey, we have an opening like this year." And normally when you hear that, you go, oh, "Okay, you get like a year to hear back, and then you go to school a year later." But they were like, no, we have a position right now. And I was like, oh my God, wow. Should I wait for my possibly getting into a US school, or should I just go? And so I decided, you know what, this is a sign, I'm just gonna go. So I went. I had an amazing time, had an amazing education. And eventually I went through the match. So after medical school, you can't, go right to being a full-blown self-practicing doctor. You have to go into being a resident. So you have to go into a residency. So that's when you pick your specialty. Some common specialties are internal medicine, adults, that's adult medicine, pediatrics, working with kids. And both of those have like fellowships after and specialties. So if you've heard of cardiology, if you've heard of pulmonology, those are some things that come after those 2 degrees. You also have degrees like residencies like neurology. You have surgery. You have OB-GYN, which is obstetrics and gynecology, a lot of women's health. You have neurosurgery is a crazy one. You have orthopedics, working with the bones and the joints. There's a few. You have pathology, we're looking at slides, diagnosing tissues and tumors and things like that. So I eventually decided I wanted to do family medicine. And family medicine made a lot of sense to me because I wanted to work with kids and I wanted to work with adults. And I wanted to do a little bit of everything. So I chose family medicine. So I was getting ready to do my apps. I was doing all my apps. And eventually I heard about this thing called MedPeds, also known as internal medicine and pediatrics. It's combined. Hold on, my mom's texting me. I even got a mom now. You know, once you become a doctor, you don't lose your mom. You still got a mom, so you got to respond. So I decided to go into this field called internal medicine pediatrics. And so I applied for family medicine and this field. And this field is a little different than family medicine. So family medicine, you get training in pediatrics, just a little bit. Internal medicine, adult care, mostly in the outpatient setting. Not really in a hospital. You get a little bit of practice in the hospital, and then obstetrics and gynecology, and then a little bit of orthopedics, a little bit of fixing bones, and a little bit of neurology, a little bit of brain stuff. So you get a little mix of everything. I didn't really care too much about the orthopedics. I didn't really care too much for the neurology. I didn't care too much for the obstetrics and gynecology. I really wanted to focus on the adults and kids. And more importantly, I wanted to do it, practice within hospital care. I wanted to practice in the hospital, acute care, really helping people out through tough times. And it was kind of a luck of the draw. I matched into a MedPeds program, and I'm out here in Long Island now practicing that, having a blast, loving my job, loving the people that I work with, loving the patients that I see. And I recently, so this is my second time on Web Shadowers, so I'm super honored. I should have said that to start, super honored to be back. So thanks for having me. But since that time, since I last spoke to some of you who might have been around, I've decided to go into a specialty. So I'll be applying to a fellowship at the end of the year in adult. So I've selected adult care over the combined in adult pulmonary medicine. So the study of the lungs, and critical care. So ICU medicine. And with that, I can work in the hospital, the ICU. I can work around the hospital, as a consultant. If certain doctors don't know what to do with a patient's lungs, they can call me. And then working in the outpatient setting, helping people with their chronic lung conditions. And because I had this MedPeds training, I want to do transitional care. So I want to help kids who are maybe late adolescents, 15, 16, get them ready to be adult patients on their own, maybe when they go to college, like a lot of you, and figuring out their life as an adult and as a kind of their own person living with their condition. So that's about me. And a little bit more about me too, before I go into more detail. I'm a type 1 diabetic. That's been my connection to the field and why I kind of loved it. And I'm sure, there'll be a question about reasons to go into medicine. So I'll delve into that deeper. But I guess the last most important thing is Zeus. There's Zeus, American Bulldog. If you want to follow his Instagram, he's got an Instagram, big time dog. And so me and Zeus are living the life out here in Long Island. And I'm happy to be here and really honored and hoping to answer your guys' questions. How long was that? 10 minutes? I rambled for 10 minutes. I'll stay on as long as you want to help you guys with your questions. All right, so the first question looks like it's from Esmeralda. Thank you, Sophia, for typing that out. What do you think is the hardest experience you've had in your field? Oh my gosh. There's so many. I'll just talk about a recent one I had. So part of my training, even though I love inpatient medicine, is outpatient medicine. I have to know how to deal with common outpatient clinical problems that might not require hospital care. And I had a patient who was very, technically on a scale, was obese. And there's nothing wrong with that aesthetically. But when it comes to patient health and preventative medicine, it's important to counsel patients. And the last thing I want to do is hurt my patient, make them feel uncomfortable, anything like that. And I had a patient who was going up on the scale. And, we follow growth curves and we look at BMI percentiles to see how a patient kind of lands in relation to the rest of the population, right? And based on that, you can see their prognosticating factors for cardiovascular health, stroke, hypertension, diabetes. So all these things are influenced by obesity. So if I have a patient who's obese, I try my best to speak about it lightly, but with a lot of weight because of how important that is. And, one of the things I say is, you might feel okay now, but you can develop issues later down the road. And I kind of go into detail. We talk about diet, we talk about exercise, and this patient really felt hurt. And I guess a lot of her peers at school and a lot of her family had put a lot of pressure on her about her weight. So she not only knew she was overweight, but was having pressure from people around her with her weight. And that broke my heart. And, seeing her cry and upset was devastating to me. But, we spoke through it, we talked about it, and she understood that to get better, she needed to do X, Y, and Z. And we went through those together. And even though our meeting was only supposed to be 15 minutes on our schedule, we were there for an hour. And sometimes as a doctor, you have to do that. You have to take time out of your day to help your patient. Some patients require more than their allotted time. And, as much as we want to say it's, it's a shift work, it's 8 to 5 job when you're in the outpatient, it's really not. I mean, I just got out maybe 30 minutes ago from my clinic that was supposed to end 2 hours before. And I'm glad I finally made this session to speak to you all. But it's really important that, when you're considering this field, you realize that you can't go into it solely for yourself, for the money, for the prestige, whatever it is. You're really going into it for the patients. And you have to understand that sometimes what you're doing is affecting your patient's well-being and their mental health. And you have to take all these factors into account when selecting this career. So that was something that was hard that's happened. I've had a lot of hard moments that happened. I'll say it again later, but for all of you, I have an Instagram and I'm not Brad Pitt. I make this joke a lot. So I will answer your message. If you send me a message right now on my Instagram, I will answer it. So I'm going to try to get through all your questions now, but if I don't get to it, I will answer your question within the next 24 hours. Okay. So please reach out to me. My page exists literally to help you all. I didn't have this. This is so cool that we have a page like this that exists for medical students or pre-medical students who want to go into the field. So use me, reach out. Okay. So thank you for your question, Esmeralda. All right. From Christian. Hi, Dr. Grossman. What jobs do you recommend we consider during a gap year? Great question. Sophia and I were just talking about this. What do you consider during a gap year while applying to medical school? Thank you. Thank you, Christian. I'll tell you what I did. I took a year off and studied for my MCATs and I tutored. I think tutoring is awesome, right? You got it fresh in your mind. You just did a bio degree or a psych degree, or you did pre-med on top of whatever degree you did. And all that information is right there in your head. So go find a tutoring company, which usually pays pretty nicely, and go teach biology, go teach chemistry, go teach physics. You've just taken it. It's fresh in your head and you can teach it on a high school level. So that's what I did. And, I didn't remember everything. I remembered what I could. And if I didn't know, I would teach myself and then teach the student. That was a great career choice for me. Sophia was talking about being an EMT. I think that's awesome. That's a lot of clinical experience, a lot of triaging to understand how a patient presents and how you should organize your thoughts on how to react to that patient, how to manage, treat that patient, and figure out, okay, they're not breathing. Okay, well, even though they cut their leg, I think the not breathing is important. Let's go to that. Let's give them some oxygen. Let's open up their airway. Let's provide chest compressions. They're not having a heartbeat, right? You have to intervene right there. The cut doesn't matter, right? Or the broken leg doesn't matter. So that's triaging, right? And also very important in ICU medicine too. So I think those are two great jobs. I think a medical scribe is a great job. You get a lot of exposure to medical terminology, and you're working. And I never thought about this. I don't know why, but you're working right there with a doctor, so you can literally see how they live their life, ask them questions, figure out what's going on, and really figure out if this field is right for you. Right? I have to say this, and I say this in every one of these shadowing sessions. It's not Grey's Anatomy, guys. Being a doctor is not Grey's Anatomy. I always thought it was, and then I got to residency, and I was like, oh, I guess it's not. But it's so rewarding, and it's so awesome, and you make a huge impact in people's lives. So that's not to say that it's not as fun, as exciting, and dramatic as Grey's Anatomy. There's more to it. but expose yourself before you get into it, before you start doing all the work for it, because you might find out it's not for you, and then you wasted all that time, right? So before anything, right, grades are important, but right after grades, go shadow, go volunteer, go get exposure to the medical field, okay? So anything you can think of. So Christian, if I didn't answer your question, reach out to me, okay? And we'll talk about options that you're considering, especially in your area. Okay. From Taylor, how did you decide to do a gap year? Oh, this gap year is a big theme today. How did you decide to do a gap year as opposed to going straight to medical school? Was that just a product of being indecisive, or did something draw you to that in particular? You know, I for those of you who might just be logging on, I wasn't sure what I wanted to do throughout some of my college career. So I ended up double majoring in biology and psychology because I wasn't sure which field I would go into. And I had a lot of work. Every summer I was in summer school. And I was okay with that because I knew that at least I was giving myself options as to what I could go into. And I was busy. So, you know, I had colleagues who had 1 degree or who were super smart. You know, I have to say, guys and gals, for a lot of you, I was never the top of my class. I wouldn't say I was the bottom, but I wasn't even the middle. I was probably somewhere in the lower tier. I thought it was okay. I worked on my work ethic. You know, you don't have to be a genius to enter medicine. You have to have a good work ethic. You have to work strong, and you have to be resilient. You have to have a good support system because there's going to be a lot of bumps in the road. That's what matters. We can talk about that later. Okay. So eventually, I finished my 2 degrees, and in that gap year, when I said, I finally have some time to breathe, I'll study, I'll get a little bit of work done, I'll do some volunteering, I'll do some shadowing, and then I'll take my MCATs because I've had a good amount of free time. Maybe I try to do a little bit of research on top of it. I think I did that as well during that time. That's why I decided to do it. You know, I think a lot of us are in like such a rush to like be a doctor, get to that final goal. But I'm like, you know, I'm 29. And fine, I'm an old fart to a lot of you, but I feel young. I feel like there's so much ahead of me, and there's so much that I like haven't done in my life. So I don't feel like I missed out. So I think that you can still live your life. Maybe you want to like go abroad and you want to volunteer. Maybe you want to go do some volunteer work. Maybe you want to work in a shelter because you like animals. I don't know. Whatever you want to do, if you can, you know, support yourself and figure it out before you go through this super long path of medical school, which I'm going to talk about in a second, you should do that. Don't you think that that's important? It's better to figure out if this is the right field for you than go down this huge long path. Let's talk about how long this path is before I answer more questions. Taylor, thank you for your question. I hope I answered it. Again, reach out if I didn't. And Diana, you're up next. I'll ask you a question. Answer your question. The length of training out of high school is typically 4 years of undergraduate, so biology, psychology, pre-med, engineering, whatever, what have you. 4 years of residency, or 3 years, let's say 3 years if you're a pediatrician or you're just doing general internal medicine. If you want to do a specialty, that could be another 2 to 3 to 4 years. Okay, so now you're looking at 4 plus 3 plus 3. So 4, 5, 6, 7, 8, 9, 10. That's 10 years out of high school. Are you willing to do that? Do you want to be a doctor that bad? If you do it. I'm so happy I did. I don't have any regrets. But maybe you do. Maybe it doesn't fit with your values, right? Maybe you want to have a huge family. Maybe you want to travel the world. I don't know what you want to do. So you have to weigh those options out. And mind you that there's so many opportunities out there for you that medical school is not the only thing. There's PA school, there's being nurse, there's an NP, there's nursing assistant, there's rad techs, there's ultrasound techs, there's EMTs, there's paramedics, there's firefighters. I mean, the list goes on. You could do so much in medicine. So just know your options. Know your options, okay? I think a good place to start is look up, like, what can I do with a biology degree? Just look up to see what you can do, okay? Public health is another one. Research is another one. Let's go to Diana's question. I hope I'm saying that right. Diane, it's a beautiful looking name for the record. Internal medicine, pediatrics, and diabetic patients has been a field of interest, and I am wanting to know more. Is it the same as doing adult internal med? So I think you're asking if my field of combined internal medicine pediatrics residency is the same as an internal medicine residency. It's half the same. So so a normal internal medicine residency or a normal pediatric residency is 3 years. So either 3 years of adults or 3 years of peds. And within each of those years, you're getting exposure to all the specialties. Maybe you'll do a month on cardiology, a month on pulmonology in those respective age groups. So that's each of them alone, which most people do. My field is so weird and vague and awesome, in my opinion, but it's not common. It's not common. We have a very niche field, and I can go into the different things people go into throughout, the med peds arena later if you guys are curious. But adult medicine just focuses on adult medicine, and it's 3 years long. Med peds takes 6 years of training and makes a lot of it inpatient. So it shuts off all of the, or rather some of the outpatient care, shuts off some of the electives, and then you're left with 4 years of critical core training, advanced, speedy training. And the learning curve is crazy. And it goes like this when you start, it kind of goes like this, but it's still really steep. So even as a third year, like I feel behind a lot of the time, and I try my best. But as med peds physicians, we know a little bit more about either field and actually can apply some of the thoughts and the processes of either field to the other. So I really love it and enjoy it. And it gives a lot of diversity in what you see and what you do and your thought processes. So those are the differences. Reach out to me if you have specific questions about that. Okay, reach out to me. And on my page, if you go to my Instagram, which is Jeremy Grossman official _ something like that. I don't know if Web Shadow has posted it. There's a link tree, and I've done a few talks. So if you want to check those out, you can check them out on the link tree. Something like 15 or something like that. And then again, just reach out to me if I'm not answering your questions. But it's a very loaded question, so there's not enough time in the day to answer it. Okay, 7:23, we're making good time. Okay, Sophia has told me now. Okay, I'm sorry, Omar is up. How should I motivate myself to study for the MCAT? Oh, Omar, my dude, that's tough. You got to do it. Like, again, it comes down to, do you want to do this? How bad do you want to do it? I was just talking to somebody or some medical students the other day who were on my service about how important everything you're learning as a bio major and as a medical student is important. Even if you're going into neurosurgery, you should still know about the kidney. You should still know about cardiovascular physiology, right? That's all super important. But I think as a student, I was like, oh, I'm not going to really need to know this. It's not going to matter. I'm going to be going into this field, these like little atoms. I don't need to know about atoms. I need to know about these equations. Guess what? You do. You need to know this stuff. There's a reason they teach it to you, and nobody tells you that, but you need to know. So that hopefully should motivate you. It's going to make you a doctor. It's part of your education as a doctor. Like, if you see yourself, Omar, as being a doctor or a PA or whatever you're going to be, I assume a doctor because you're going to take your MCATs, then you should view it as such that it's going to help you. And that's part of what your degree training is. So if you're willing to do the next 10 years of training, you better be willing to do the MCAT, right? And it's tough. The MCAT's not an easy test. I feel like the toughest part was the reading section. I can't like interpret text and undertones, and it's so difficult. I don't think I scored very well. I think I barely passed that part. That was like my weak point. Okay. Thanks for the question, Omar. Reach out if you have specific questions about that. Okay, Taylor. Is this a different Taylor? Maybe it's the same. Do you see an equal amount of inpatient, outpatient cases, or is it more of one or the other? So again, that depends on your specialty. So if we're comparing family med to med peds, family med sees probably like 60% outpatient, 30% or 70% outpatient, 30% inpatient, whereas I see 70% inpatient, 30% outpatient. And the lifestyle is totally different. What you're doing day to day and minute to minute is totally different. There are some crossovers, but the lifestyle and your kind of the way you think and move and act and feel are different, at least for me when I'm in the outpatient setting. Taylor also asked, is there any aspect of the job that you don't enjoy or don't agree with? Documentation is tough. And I always hated it, writing notes, writing down every little bit of information, a little thing that you did all day can be tough. But you know what? It helps you organize your thoughts. and it helps you lay out a plan for your patient, and then you can review it the next day in case you forgot some of it to see what you did and what your thoughts were. Because sometimes you have so many patients, you've seen like 30 patients in a day, they all just like blend together. So I actually like it. Some of the things I don't know if I don't agree with anything, right? Because I'm still learning. So people have different practice methods and ways they interact with patients. I typically come into a room and I'm very light, funny, and airy, whereas some people come in very seriously. So it kind of depends on your style and what works with you. What's great about medicine is it's called, it's the art of medicine, right? So there's a certain kind of special way to do it that varies from person to person. And it's only something that I can really explain or even understand myself after I've kind of been exposed to it as a resident, not just as an observer, as a medical student, as a shadower, in college. So hopefully that answers your question. All right, so from Pragya, what would a typical day at work look like for you? Okay, this is important. I actually, if you're not listening right now, if you're like studying or like watching TV, this is the part I want you to listen to, because I didn't really know this. So I wake up at 5 a.m. in the morning, okay? And then I turn my alarm off because I'm tired, and then my alarm goes off again, and then I turn it off. And then around 5:45, I finally get out of bed. And then I wake Zeus up, who's over here now, munching on some toys. So I wake him up and I feed him, I give him his pills, he's got arthritis. And then we go for a walk. Then I drop him off, put the TV on for him. He has a walker that comes and sees him in the middle of the day too. And then I go to the hospital. So I'll describe a hospital day. Once I get to the hospital, I find the doctor that was watching my patients overnight, right? Because you need doctors there, not only during the day, but at nighttime, right? Because things can still happen at night. But typically less happens at night because when people are asleep, less things are being moved around and messed with. So there's typically less. So the doctors typically cover more patients. So I go to that doctor tells me, Mr. Johnson had a cough, we ordered a chest x-ray, he has pneumonia, we started him on antibiotics. Mrs. Tomlinson had a headache, I gave her Tylenol, didn't help. We did a CT of her head, it looks like she had a stroke. So we sent her to the neurology service. And then Mr. Johnson, or did I say Johnson? Mr. Billy got discharged, or rather left against medical advice, and he got frustrated and just went home. So he's not our patient anymore. So I go, okay, I write down what he or she says. And then I go see the patients for myself. I go check on them, do physical exams, and then I review my plans. I review my notes from the day before. I double check to see that, everything's in order. I order new medications, order new blood tests, order new imaging, maybe discharge some people, maybe accept some new patients from the ER who just came to the hospital, right? And that happens from, most of the morning. Afternoon, I've usually done most of my stuff and I'm just responding to things, right? So I'm seeing if the therapy is working for Mr. Johnson, or I'm seeing if Miss Barbara's cough is getting better. Maybe I should add some Robitussin to like help her with her cough. I don't know. Maybe the CT scans come back. Maybe one of my patients went for surgery and I'm following them up and I'm realizing that they're still bleeding. So we need to call surgery back. And so I'm just responding to things in the afternoon. And, as a resident, I have interns, or as a senior resident, I have interns who help me out and I teach them. And we have an attending who helps us out and teaches us kind of higher level thinking stuff. We review, we talk, maybe we do some practice questions together. So, we're doing as residents, we're being doctors, but we're also still learning. And there's a big learning curve. And even today at clinic, I had a patient who was really tough and I totally missed an otitis media, an ear infection, but my attending picked it up. So, even though I'm a doctor, I still make mistakes and I still miss things. And that's what's so important about residency. You're learning how to be a doctor. Just when you get that MD degree doesn't mean, or that DO degree doesn't mean that you're a doctor, right? You have to go through the processes of learning how to be a doctor under some supervision. So that's why residency is so important. All right, so that happened in the afternoon. Then that doctor from the night comes back. I sign out to them, and that's it. That's what happens. And then somewhere in between there, I have like 5 or 6 coffees and maybe some lunch if I'm lucky. And then some days we have like lectures that are put on by our department, like teaching lectures, and we discuss cases and stuff like that. So That's like a typical day on the ward. In the outpatient setting, you come in at 8 or 9, you see a patient every 15 minutes to 30 minutes. You maybe order tests, you do a physical exam, you give them new medications, you tell them to come back, you send them to a consultant, maybe they had a murmur, you don't know what it is, so you're going to send them to get an echocardiogram, pictures of their heart, or you're going to send them to the cardiologist to see how they're doing. And you do that, till 5, and then you go home. So that's very basic general idea of what, the inpatient versus the outpatient setting is. And I recommend, if you guys and gals are interested, to do both of those as shadowing opportunities. Okay, cool. Hopefully that answered your question. Jonathan, so many questions. Thank you for the questions, everyone. What's your favorite part of working in the medical field? I think like being able, when you walk in a room, and it doesn't come like this, but after you've seen something a few times, if you can walk into a room, maybe do a physical, maybe talk to them, maybe order a test, and come back and say, I know what you have. I can help you. You give them something and they feel better and they're so thankful. I mean, how cool is that? Like, you literally just like help somebody out, like in an instant. I'm sure there's other fields out there that are similar to that. I know a lot of teachers made me feel that way, made me feel so much better by teaching me certain things that I couldn't get into my brain. But for me as a physician, that's been so cool. And I do that day to day, like every minute, every hour, like that's going on. So it's just like a constant rush of endorphins. And that's what I love about it. Hopefully that answered your question. There's so much more to that. Such a loaded question. Come on, Jonathan. That's a tough question. If you want to go into that more, let's talk about it when you message me. Okay. All right, George, how did you find research opportunities and in-person shadowing when you were in college? So, one way that I did it was I had a professor who was like teaching like microbiome, and I looked him up and he had like a lab. So I messaged him. Another way, a lot of universities have like a list of research opportunities that you can reach out to. A lot of people post like, hey, interested in working in our lab, like on the like post-it boards throughout campus. That's cool. And then like, you can always ask upperclassmen if they know about any opportunities or if they're in any labs, and just get involved like in extracurriculars and just talk to people and find out. A lot of stuff I like didn't know. There's a lot of people who like maybe have family in the medical field, so they like know all this stuff that they're supposed to do. I didn't have anyone, so I had to kind of figure it out on my own. And sometimes that delayed me, but ultimately it worked out. Okay. Next question here. Okay, from Faith. Sorry, I couldn't find it. In the pediatric field, how do you work with parents who aren't making the best choices for their child's health from a medical perspective? That's a good question. And I'm first going to take this toy away from Zeus because he's making a lot of noise. Problem solved. There we go. We'll give him this one instead. I prepped him for when he makes noise during these things. Okay. In the pediatric field, how do you work with parents who aren't making the best choices for their child's health from a medical perspective? Well, there's certain things that parents have like they're able to allow or do, even though we don't agree with it. Like certain vaccines you can hold off on, but a lot of times schools require them anyway, so they have to end up getting them. COVID vaccine's a whole nother discussion, but you all should get your COVID vaccine if you haven't gotten it, by the way. It works. The stuff works. So if a parent is denying treatment for a patient that could save their life, you have the ability to tell them sorry, no. And then if they give you trouble, you call the police, you call security, whatever it is, because this can save a patient's life, then the law allows us to do so. You don't want to have issues with a family, and you want to try to talk to them about it first, and because you want them ultimately to trust you, right? If you just kind of fight with them, then they're never going to trust doctors or the medical field. So ultimately, you try to explain what you can. and try to get them on your side of understanding at least. And if you can't get it, you can't get it. Flu shots are another one. I couldn't convince this family to get a flu shot today. And then other times they're like so cool with flu shots. So like, I don't know. Hopefully that answered your question. All right, from Jonathan, how has, hold on, mom's texting me again, here, 1 second. Oh man. Sorry guys, I still got life going on. This is like my, I just got off work. I got to answer all these questions. All right, so how has the pandemic impacted your experiences in the medical field? Wow. It's kind of in the aftermath. And like great things like this have opened up, like web shadowers has opened up these opportunities for you guys as students, which is fantastic. And it's exposing you to people who are just talking about the field. I don't want these talks to be like, like talking about, like, oh, let's talk about a case. I want it to be about, like what it's like to do this, right? Because ultimately that information might not really be relayed to you one-on-one. I might be able to, answer your questions right away. But in any case, the field of medicine has been pretty largely impacted by COVID. I mean, every patient that comes in, you essentially have to screen for COVID. But beyond that, it's on your differential for a lot of conditions that are coming in. And there's a lot of weird things that can happen following a COVID infection, like myocarditis, right? You can have inflammation of your heart. Just happened to a patient I just saw in clinic today, for example, or potentially happened. We don't know. She needs to get an echo of her heart. But when the pandemic first happened, I was end of my first year intern. So interns, like, we're doctors, but we're just out of medical school. So you hope to have learned some degree of information by that point, but it's still very fresh. So coming in with all these patients who were sick and requiring intubations and respiratory therapy and vasopressors to increase their blood pressure, I mean, that was crazy. It scared me and intimidated me. But ever since then, I've put a lot of my educational learning directed at learning all of these kind of life-saving therapies in acute situations. And it's a big, thing, right? Because I chose to go into ICU now. I took the thing that I feared the most and really exposed myself to it. And I love the field now. So COVID impacted me personally to a super huge extent. So I hate COVID, but I guess I have a lot to thank for COVID, for exposing me, allowing me to be exposed to the patient population that I was seeing. COVID also has a lot of, obviously has really affected society a lot too. So people have disagreements about its existence at this point, which is sad. But it's been a fun ride, and I think more and more people are coming around and getting vaccinated. And I recommend all of you to get vaccinated and tell your family and your friends to get vaccinated too, because I don't want to see you in the ICU. I'd rather see you in the outpatient setting for like coming for your flu shot or something. Okay, that's Jonathan's question. Okay, Diane, not a question. Oh, that's very sweet of you, Diane. Johnny's saying how a lot of doctors made a huge impact in her life. So that's awesome to hear. Her pediatric doctor made a big difference in her life into adulthood, being a low socioeconomic status and underserved individual. That's awesome. Reach out to me. Let's chat, Diane. Reach out. Okay. Pragya has got another question. What would you say is the most important skill to have as a physician? I think empathy, I would say. I mean, obviously it's important to like understand what, your patient has, diagnosing them and treating them and all that. And that's a given. But I think one thing that really can't be taught is empathy. So if you have always been that kid on the playground who saw one kid sitting by themselves or getting bullied or looking unhappy, and you felt, you might not have gone over and said something, but if you felt the need inside of you to go over there and talk to them and help them, make them feel better, you'll probably make a good doctor. That's probably the most important thing. There's some days I'm so tired and like I don't want to have the empathy that I do, but I do. And you know, I could just go home and forget about this new guy that just came in who's got no IV lines and he needs certain medications right away. And even though I just signed out to the doctor who's supposed to take over for me, you know, I've gotten to know this guy and he really needs access. And, you know, I can't go home without a guilty conscience, right? Without helping this guy get his IV in and or his special IV, right? And getting him this medication. So stuff like that, you know, and I just had a patient who just immigrated here from another country and made an appointment for like a 10-minute time slot, and he's got all these problems. So I was there like an hour late. So you got to be willing to do that. And I'm not putting myself up on a pedestal by any means, but you got to be willing to help people out. And, you know, nurses out there do an amazing job at that and put their heart and soul into things. And so it's not just doctors, it's also techs and PAs and NPs, and you know, all these fields are fantastic to consider if you're considering the medical field at all. I know I considered being a PA for a little bit. And I probably would have done it if I didn't get into the school that I did. Okay. From Evelyn, what do you think about nurses going into medical school? Have you met any, or are they accepted into the med community? Yeah, first of all, I think if nurses want to go to med school, hell yeah, why the heck not? You've been exposed to like so much patient care and you have like a totally different view of how a patient should be treated. So I think you would make a fantastic physician. So yeah, why the heck not? I think most nurses that I've met who've decided to go into higher education or have more of a practitioner, which is like more of a doctor, order writer, prescriber lifestyle, ended up going into NP school and getting their nurse practitioner degrees. And ultimately those, you know, nurse practitioners are, first of all, they're all fantastic. As a type 1 diabetic, I was treated by a nurse practitioner for a large portion of my pediatric life. So I owe a lot to nurse practitioners and I had a lot of positivity towards them. So, you know, if a nurse wants to go to med school, heck yeah, I think that would be great. And if they want to go to NP school, that'd be great. If they want to go to PA school, that'd be great. Whatever you feel is right for you, I think is totally fine. If you're like have been working in business for 10 years and you want to go to med school, go. What are you waiting for? Just do it. Just try it. In my med school, I had a guy who was 40 in my class, and now he is going into oncology, so cancer, and he just got like published to like some Nobel, blah, 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 like big time stuff. So it's never too late. So I don't know if any of you are older than the normal crowd who's applying, but it's never too late. And no matter what career, you can try it. Specific questions, reach out. We can talk about it more. You think that? Okay, so Nina and Esmeralda have asked this question. Do you think that someone with a mental illness has the ability to be a good doctor? Heck yes, 1,000 times yes. Okay, if you don't understand what it's like to go through a difficult time, then I don't know, why do you want to be a doctor if you don't understand that? Well, how are you going to help that person out? Right? That's so important. I've had plenty of times of sadness and anxiety in my life. You know, I've spoken to a counselor if I've had a tough time. And I think that, yeah, I think that makes me a better doctor. Do all doctors need to have had that? I don't know. I know that I feel a lot better about treating my patients with mental illness because I've had at least a taste of it or have an understanding of what it can do to your kind of your being and how you feel and how you go to, go through your day. So yes, don't let that stop you, ever. And if anyone tells you, let me know. I'll reach out to them and I'll handle them. How do you handle your mental health during the process of becoming a doctor? As an extension of that question. I've tried meditating recently and I love it. I'm like obsessed with meditating. If you haven't tried meditating, it's a really cool option. Talking to friends, talking to family, exercising, getting a dog and hanging out with your dog. Whatever makes you happy. Whatever makes you happy. We're like humans. I think I used to see doctors as like these like gods almost. We're not gods. We're like pretty whatever. We just have degrees in medicine. We're normal people. So we just need normal people stuff. Like if I have a good poke bowl, yeah, that makes me pretty happy. A good poke bowl. All right, Kristen. Thanks for the questions, guys and gals. Reach out to me if I'm not answering your questions fully. With all the crazy hours you have, how do you find the balance between work, family, and yourself? The hours are crazy, but the more you go on, the more time you have. I've been away from my family in California this is like year number 7 now. I visited them, but year number 7. And you have to be okay with that because the path doesn't always follow what you want. It kind of follows what it wants. So there's match processes and applications and accepting. And so you have to be open to being apart from your family, and that's okay. It's great that we have, planes, trains, and automobiles that we can all reach each other now. But, that's awesome. But, having that resilience and that support and, that's going to be important along the process because you don't know, it's not that you're always so close to everyone. But you adapt. I had a very, very difficult time, very tough mental health period when I was an intern. And I, go out of my way now and help people who are having a tough time. But people, aren't always willing to accept that help. And that can be frustrating for you. But you can only offer what people are going to accept, really. So you'll be good if you've got good coping mechanisms. You figure out what makes you happy. You've got organization. You can do it. I can't stress enough that I was never the top of my class. I was always middle bottom, but I was a hard worker. I learned how to be a hard worker eventually, and now I'm here. Right. From Timothy, what is your diet like on a typical work day? I think a lot of people's diets as an intern get really bad. You're tired all the time. You're not sleeping as much as you used to. You're running around. You're stressed. So you stress eat. I think I gained a little bit of weight in my intern year. That's okay. But as you go on, you learn to figure out what works for you. So maybe you exercise on these days or you have one cheat day. Again, we're just people too. So you just kind of figure out what works. For me, my diet is I drink a lot of coffee. I don't have a lot of time to exercise. So by that, I try to cut down on my carbohydrates, which is also good for my diabetes. So I drink coffee to kind of fill me up, suppress my appetite a little bit. And then by lunch, I pig out, have a nice big salad, maybe a little piece of bread from Panera. Bread's not the best though. And then I come home and I'll have, dinner, veggies and shrimp. My girlfriend will sometimes make me veggies and shrimp, which is really nice. Shout out to her. Yeah, that's pretty much it. If you have questions about diet, I'm all about that low carb lifestyle. Okay. Where is this? How many hours do you usually work per week? Well, if I'm on an inpatient service, I work 12 to 13 hours a day, 6 days a week. So let's do the math. 12 times 6, 72 hours. And then if I'm doing 13 hours a day, that's 78 hours. That's a lot. And then on top of that, I do research. I do studying, try to hang out with friends. It's doable. You figure it out, right? So you have to get those organization habits now. You got to do them now so that you can be prepared to organize the craziness that is medical school and residency. Okay. Okay. From Linda, do you work with PAs? And if so, how do your roles mesh together? I've worked with PAs, and people in the ICU field do, and people in a lot of fields of medicine do. Essentially what happens is they'll see the patients, present them to you, and then the doctor will decide, okay, I trust what you're saying, or wait, I have to go take a look at this patient for myself. So ultimately, when a PA sees you, you don't necessarily need to be seen by the doctor. So after some time, you know, a PA goes to school, I think it's like 2 to 3 years, and then they come out and they can go to any specialty they want to go. They can jump around. That's why being a PA sounds like so cush. You can be a cardiologist 1 year, and then you can be like a radiologist the next year. I know this one PA who just does like crazy procedures with interventional radiology, which is another specialty. He does paracenteses, he drains people's abdomens, he puts lines in patients. He does literally anything under the sun. He's a PA. He's been doing it for like 20 years. So you can really do anything as a PA. You just won't be called doctor. And if you're okay with that, I totally recommend it. I think it's an awesome field. And I think you can get into education if you like working at PA schools, you know. Okay. Christian, what are important factors to consider when choosing med schools to apply to? Honestly, Christian, thanks for the questions. Again, money is important. Your strength of your application is important. How good are your grades? How good is your MCAT? Do you have research? Do you have good volunteering hours? All that stuff. If you think you're a strong candidate, you know, apply to the best, you know, the big names, you know. If you're an average candidate, don't be stingy. If you got to spend grandma's inheritance, I would apply broadly. If you're okay with going to the Caribbean and Israel, as I think you should be, or China or Europe, wherever you want to go, apply there. If you're a doctor, you're a doctor. The only thing I'll say is the one thing that you should care about is match lists. So on every medical school you apply to, look at their match rate. So the closer to 100%, the better. It should be pretty close to 100%. Only 1 or 2 people should not match a year. And those are typically people who have something like a red flag on their application that can't really be fixed. Okay. Reach out if you have questions about that in particular, okay? For the record, I applied to USMD, USDO, and international MD schools. And I didn't finish a lot of my apps because I got into this school in Israel, it's called Sackler School of Medicine at Tel Aviv University. And it's got a great connection to the state of New York. So I had an in, and they had great match rates, and it made complete sense to me. And it worked out tremendously well for me. So I'm very, very, you know, lucky in that sense. So we'll talk. Okay, Kristen, I'm the oldest in my family and the first in my immediate family to go to college. So most of the time I have to find things out on my own. What resources do you feel really helped you through the process? These shadowing sessions are huge, big time. You now have my Instagram, and you can message me for questions, as a lot of people do, because I answer. And again, I have that guilt and empathy where if I don't answer and help you out, I'm going to feel bad later. So I will answer you. I would watch the videos like Med School Insiders has like these great videos on YouTube. There's a lot of like YouTube videos that are out now that weren't around a few years ago that explain like every little bit and piece of medical school. I think what you should do is think about what you think a doctor is. If you think a doctor is a plastic surgeon in your head, look at what plastic surgeons have to do. Go look up Johnny the plastic surgeon and see what tips he has or she has. Email them. If you have, you know, you're in an area where there's a plastic surgeon, email the office or call the office. Say, hey, I'm a resident or a med student or a pre-med student. I'd love to shadow. Am I able to do that? A lot of them are happy to have you. Guidance counselors are important at school. They can give you a lot of information. people who are in your upper class are important. If you know somebody who like recently got into medical school or is applying right now, I would ask them. Okay. Reach out if you have specific questions. Esmeralda, how did you get a closer relationship with your teachers so they could give you recommendation letters? I have a tough time trying to connect, and even though it's only my first semester, I'm nervous. It's so early. So early. You know, I don't just ask like teachers for you know, letters of rec. You have 4 years, right? You have 4 years, or 3 at least, if you're going to apply your last year. So don't stress too much. I don't want you to be nervous, but I want you to be excited. From now on, when you guys and gals say you're nervous, change the word to I'm excited. Okay. And that'll help change your thought process about the whole thing. So I would get your letters of recommendation from people who you're doing research with, people who you're shadowing with, people who you've worked with in the work kind of community with, maybe at a job you've been at for a few years. Maybe you have you go to a medical club and there's like a counselor who's a doctor. I would go to them. Stuff like that. People who you're actually gonna just kind of be like interact with no matter what. Like there's not gonna be a reason for you to like have to go out of your way. You know what I mean? Yeah, you're gonna want a natural environment where you're gonna have connection. And I think shadowing and research is the best way to do that. Again, I'm just speaking from my own advice. Okay, Pragya, were you able to pursue any hobbies during your medical school journey? Heck yeah, outside studying. Outside studying. Are you saying is outside studying cool? Yes, studying in the park is very cool, and I like studying outside. And Zeus, I think Zeus agrees. He's looking here now. But I think your real question is, do I actually have hobbies outside of it? Yeah, heck yeah. I was in like a medical, or not a medical, like an academic fraternity, and just interacting with people is so important. So make sure you have time for friends and interacting. I used to play basketball at the gym, pick up basketball. Yeah, I mean, yeah, and even now I have time for hobbies. You should always have time for hobbies. What I recommend to everyone to do is Saturday or Sunday every week, look at the next week and plan out hour by hour, chunk by chunk, what you're going to be doing for the next week. Then you're only going to be focusing on that day. When that day comes, boom, you're just going to be focusing on that day. So if you've gone through all the tasks that you've given yourself, and then that last few hours of the day, you can say guilt-free, these are my hours. I've done what I've allotted myself to do for the day. And now I can go do that stuff. That's what I recommend. Okay. Scheduling, organizing how you live your life now is going to impact how you live your life as a medical student, as a resident, and as a doctor later, because there's so much going on. If you don't have a way to organize what you're doing, you're not going to be able to do it. And again, I'm bottom of my class, very average student, okay? And I'm able to do it, so you can do it too. No excuses, okay? From Faith, how have you navigated maintaining relationships, whether it's with family, friends, or with other during your time in medical school and residency? You know, you try your best. You know, you text your family, you call your friends. My girlfriend just switched to night shift. She's a nurse. So, you know, you make it work. You figure out a time that works, right? Sometimes when she's sleeping, I'll just come over with Zeus and do studying. And occasionally if she wakes up, we'll say hi, high five, and then she goes back to sleep. You know, you do what you can. We're all just trying to get along here. It's totally possible to do, you know. The first year of every chunk, so the first year of college, the first year of medical school, the first year of residency, the first year of being attending is always the hardest. And once you kind of figure out and you troubleshoot, you know, things that come up, you can proceed on, and it gets better and it gets easier, and you're able to plug more stuff into your weekly schedule so that you can, you know, enjoy your life. Okay. We can talk more about that, but it's totally possible to do, but you got to work hard. When it's time to work, you got to work hard. Okay. From Blake, what was your favorite part of med school? Like, I'm assuming class-wise. Anatomy is cool when you have the corpses and you're really seeing what a body looks like on the inside. That's pretty amazing. And I still, to this day, when I'm, working with patients or dealing with patients who are on ventilators and thinking about their physiology and trying to figure out what's wrong with this patient, I go back to the anatomy lab and I remember what I saw and how things laid out. It's pretty cool. Anatomy is very cool. I was very intimidated by physiology, how everything works, moves, breathes. It's very complex, a lot of math equations. And I kind of just did the minimum to get through it because it was so difficult. And now I'm having to catch up because I'm going into the ICU, which is like all physiology and all how your heart works, your lung works, and how that goes to your kidney and your liver and your brain. So everything you're doing right now is important. There's nothing that you're not doing right now that's important. No matter at what stage you're at, don't look at what you're doing as a stepping stone to what you want to do. Look at it as what you're doing and what you want to do. It's happening now because it's a part of what you're going to be doing. Okay. That's how you should frame what you're doing. Everything is important what you're doing right now. And that should help you out in terms of getting through the monotony and the difficulty and the pressure and all that. And on that note, guys, stop putting so much pressure on yourself. Okay. Just stop. You can put a little pressure on yourself. Give yourself a break. You're just a human. And the med school thing is so difficult and so crazy. And guess what? If you don't get into medical school, so what? You can literally do so many things that make a positive difference in people's life. If you want to make money, there's so many other ways for you to make money. If you want to do something in the medical field, there's like way more jobs than doctors to make a difference in the medical field. So you try your best, you work hard, you put a little pressure on yourself to get stuff done, but don't be so hard on yourself. It's not worth it. Our lives are so short. I'm already 29. I can't tell you how much pressure I put on myself, and I'm still putting on myself. And now I'm thinking about all the pressure I put on myself today. I've got to chill. I'm so like not chill sometimes. I don't want you guys to be not chill. Just relax, enjoy your life. Okay. All right. From Blake, what was your favorite part of, I already answered that. Oops. Final question from Sophia, the Web Shadowers host. What is the best piece of advice you have ever received? That means she's cutting me off. The best piece of advice I've ever received. This is such a difficult question. You should have sent me this before, Sophia, so I had like a nice prepared answer. I'm just gonna echo my advice because I think it's my important. She just texted me, my bad. No, I'm messing with you. It's all good. The most important thing, and I've just said it, is, and I kind of like to wrap up my talks with this kind of piece of advice anyway. And it comes from my own experience. Life is so short, and it's tough going through the medical school field because it's right in the middle of your young life where you develop, where your brain develops, where you develop as a person, where you make relationships, you understand who you are and your relationship to the world and how you're going to impact the world. So you miss out a lot on doing that, or rather you try to do that while you're doing all this other stuff in the medical field. So while you guys and gals are here where you're at now, in high school, in college, in medical school, just every once in a while, just take a step back and just think about how grateful you are for what you have and what's around you. Think about how you love what you're doing, how you're working hard, and how that should be enough for you to be proud of yourself, right? You don't need to get into medical school for you to wrap it up and say, okay, I did it now, I've done it. No, it's not about that. Because guess what? You get into medical school, you get into residency, great, it feels nice for a second, but you're still working your butt off. You're still tired, you're still stressed. It doesn't go away, So building those skill sets of how to just like be zen and just like enjoy yourself and your life and the people around you right now is such a huge skill that I don't know if I really ever honed and still have honed, and I'm still trying to hone. Because the way you experience your life is so important to you. You're going to spend so much time taking care of your patients. You got to know how to take care of yourself. So in summary, stop stressing out, keep working hard, and reach out to me on Instagram at Jeremy Grossman Official if you have any questions, so I can help you out, answer your questions. I wish to all of you the best of luck. Don't be so hard on yourselves. Enjoy your life, and adopt a dog. Okay, guys? Adopt a dog. Thank you.
Thank you so much, Dr. Grossman. This was such a wonderful talk. Thank you for answering all of our questions. To all the viewers, I think I got all of your questions, but if I didn't, please message Dr. Grossman on Instagram. It will be, or it's at it's at Jeremy Grossman _official. That's on our Instagram and will be in the description of this video. And I've posted the Google form for attendance in the chat box, and that'll also be in the description. You have 30 minutes to fill that out. And once again, thank you so much, Dr. Grossman. This was so wonderful.